Well, hello and welcome. I want to thank you all for attending Hawthorn University's webinar series. I'm Paula Bartholomew, the Director of Online Events. And I'm always pleased to be able to be here and to facilitate these presentations. It's such an honor. I want to let you know that we'll have time for your questions at the end of this presentation, and we'll certainly respond at that time. So just write them into the webinar question panel at any time. And I'm certain we can expect terrific information here today. So this presentation is being recorded and it'll be available for replay on our website in just a few days. And I want to let you know that if you're listening for the first time, that Hawthorn University's Holistic Health and Nutrition Webinar Series is a platform that brings excellent information and resources for our students and our alumni and faculty to be able to augment their Hawthorn education and to expose us all to a wealth of knowledge and experience that our guest presenters bring to the table again and again. The many ways that our students and grads are using their Hawthorn education in their practices is nothing short of amazing. We have a variety of accredited degree and certificate programs at Hawthorn. Some of them are for people that are pursuing a clinical track with the goal of working directly with clients. We have other programs that are dedicated to those that are seeking to primarily educate, be that by writing books or developing courses, workshop programs, doing public speaking, a variety of options. And then certainly we have courses and programs for those who simply want to learn valuable, credible information in a conducive environment. I always say the success of our students is a testament to Hawthorn's mission and principle to provide quality, affordable, holistic health and nutrition education. Our webinars are always open to the interested public too, because we love to learn more at Hawthorn. Okay, that brings me right around to today's webinar and the fact that awareness of nutrition and health supportive practices are growing, thankfully. So we're truly fortunate to have Dr. Bianca Garilli inform us about the military veterans' health care and improving awareness and access to integrative and functional medicine solutions. We're going to learn that with over 22 million military vets in the United States, the topic of veteran healthcare is certainly an important one. And the goal of this important webinar is to increase awareness of the healthcare challenges facing our nation's veterans and to be able to explore the emerging integrative and functional medicine solutions that will solve these issues. And Dr. Garilli is going to frame where she's going to go with all of this in just a few minutes. But I wanted to give you a little bit of background on her if you've not had the pleasure of listening to her previously. Dr. Garilli is a former U.S. Marine turned naturopathic doctor. She runs a private practice in Northern California and consults with the integrative and functional medicine leaders, including Institute for Functional Medicine and Metagenics. She is passionate about optimizing health and wellness in individuals, families, companies, and communities, one lifestyle change at a time. Dr. Garilli has been on staff at the University of California, Irvine, the Susan Samuel Center for Integrative Medicine, and is on faculty at Hawthorn University. She is immediate past president of the Children's Heart Foundation in the California chapter and is currently deep in the trenches with the Military and Veteran Functional Medicine Health Initiative. Dr. Garilli feels blessed to have been married to her husband and best friend for over 20 years, to be a mom of 2 amazing children, and her family spends time together on baseball and softball fields, cooking, eating, gardening, skiing, and camping. This is a happy family and a happy doctor. It's a pleasure to have you with us again, Dr. Garilli.
Thank you so much, Paula. I am certain that this is going to be a great webinar. I'm so excited to present this information, and I am really appreciative that you invited me to do so. So my background is as an Army family. I grew up, my father is retired Army, and we did a lot of traveling throughout the world, actually, as I was growing up. And when it came time to decide what I was going to do with my future, I decided I would join the service as well. And my parents both said, absolutely, but let's check in with all the different services. And I guess I had never really considered anybody else except the Army until I heard the Marines. And then I said, well, that's said and done. I'll sign right there and sign up to be a United States Marine. So that was how it came to be. I'm very happy that that was the course that I ended up taking. I spent 6 years in the Marine Corps. 5 of them were active duty and 1 as a reservist. In the 6 years that I spent in the Marine Corps, I was actually trained as an Arabic linguist. And so I worked in the cryptologic linguistic field. I also worked as a Spanish linguist. And then there came a time where they needed additional weapons instructors, and I was blessed to have the opportunity to become one of the first female small arms weapons instructors on the East Coast as an enlisted Marine. So fast forward through the first couple of years in the Marine Corps, and I started to become interested in the foliage, if you will, around the area of North Carolina where I was stationed. We'd go out for runs, and I started looking around and saying, oh my gosh, I wonder what that plant is, and I wonder what that tree is. And fast forward a few years, and I had learned most of what was out in the woods of North Carolina, and then decided I wanted to know what everything did and what purpose it had for the human body or for physiology in general. And that led me into a pathway of becoming a naturopathic physician. And after getting out of the Marine Corps, I ended up at Pasteur University and finished up my degree there in 2008. So it was a long road, but it actually, when I look back on it, every piece had a purpose, and bringing me up to fast forward to now, to where I am trying to bring back together this piece of integrative, functional, and naturopathic medicine into the field of military and veteran healthcare. Excuse me. And it's been a great segue, because a lot of groups, I was just telling you a few minutes ago, Paula, there's a lot of groups right now realizing that we need to come together as community and networking for the purpose of supporting our veterans and bringing in new ideas and new modalities into the veteran healthcare system. And so I think it's a really great time to become invested and interested and educated in this area, so that we can really support the unique needs of the veteran community. And so we're going to go through quite a few pieces of that in the upcoming webinar today. Let's see here. I'm so sorry. Okay. I wanted to just lay out a few learning objectives. The goal of today's webinar is to increase awareness of the healthcare challenges facing our nation's veterans, and to learn about the emerging integrative and functional medicine solutions to solve these issues. The learning objectives include reviewing the varied demographics within the veteran community, discussing the unique set of healthcare challenges that do face our veterans, exploring the integrative and functional medicine approaches that are currently available both in the Veteran Administration, or the Veteran Affairs and Veteran Health Administration, and also within the private sector that are serving veterans, understanding the current healthcare gaps that continue to exist for veterans, and then discussing and bringing forth some innovative ideas that are coming to fruition for being part of the much needed solution. So I'd like to first begin by taking a peek at who are our nation's veterans. We can go through a lot of different demographics, but in a nutshell, we have between 20 and 22 million living veterans in the United States. It comprises about 7% of the entire nation's population. And interestingly enough, the fastest growing subpopulation, both within the active duty component and within the veteran population, are females. So the total force active duty currently is approximately 15%, made up of approximately 15% of females, while in the veteran community, it's about 11% currently, but estimates show that by the year 2045, females will actually make up about 18% of the veteran force. I say that because what we find that there's a large gap in right now is the women healthcare component of the veteran affairs and the Veteran Health Administration. So those will be gaps that, again, as the VA, but also in the private sector, will be able to come together and help to find solutions for. We can also see that there's different demographics in terms of ethnicity and backgrounds, and that also will be changing over the next years. And so again, we may need to find new and innovative and unique solutions for the challenges that come up. We can also categorize our veterans into additional subcategories based on the eras that they served. So for example, we have a Vietnam War and earlier cohort, and that would comprise the years of service between about 1939 and 1975, or the World War II, Korean conflict in Vietnam. And then we have our pre and post 9/11 veterans, which would include our roughly about 1990 to present. And in 2016, we can also see that demographics are changing in terms of age group. In 2016, 27% of veterans were younger than 50, whereas by the time we do get to 2045, we'll see that over a third of, or roughly a third of veterans will be younger than 50. So again, we're going to really need to think ahead and determine what challenges might arise during those time periods for the different age groups, the different genders, and then also the different ethnicities if need be, and then come backwards and start to work on those solutions ahead of time. If we look at the actual conditions or illnesses or symptoms related to the different cohorts, we can also see that they can also be categorized by the era that the veteran served in. And so I won't go through all of these, but you can see there are some various differences between the different groups. If we wanted to summarize a little bit more in terms of the verbiage we may use outside of the VA or outside of the military service, we'd see that we're really facing challenges in the cardiometabolic area, chronic pain, TBI, which we'll talk about more, traumatic brain injury, concussions, mental health aspects, neurological issues, also a lot of issues with sleep and insomnia, fatigue, Gulf War illness, chemical biological exposure, substance abuse, suicide, of course, is a big one, and then homelessness. So we're going to touch on a few of these today and really delve deep into the top few there. So the first one I wanted to really jump into and talk about might come as a surprise to many of us. We might typically think that service members and veterans as a whole may have better statistics when it comes to obesity or metabolic syndrome than the general population. And interestingly enough, although the active duty side does have better rates, not as obese, we have found that that number in terms of active duty side is also increasing. However, when we look at the statistics from the veteran side of the picture, we can see that it mirrors, for the most part, the general population statistics and rates for obesity. So you can see here, if we define obesity as a BMI of 30 or greater, that the VHA data VHA data shows that there's between 25 and 41% of our military veterans have been diagnosed with obesity. If we look at the most recent 2018 study, we see that the prevalence of obesity is right about the 32%. We don't see a big significant difference between rates in the male and female population. But what we do see, and I think sometimes we forget, that there's a lot of overlap between obesity and chronic disease processes, as well as specific military conditions. So when we read through these, we can see the obesity and comorbid conditions that we would likely see in the general population, which would be arthritis, we've got pain, diabetes, heart disease, kidney disease, migraines, etc. But things that we might not think so much about in terms of obesity and comorbid conditions, particularly in the veteran population, include lifetime prevalence of PTSD, mental health treatment, nicotine dependence, poor sleep quality, and actually also TBIs, and then the pain factor that we talked about. The cost of obesity, if we're just looking at the veteran population, is pretty phenomenal. And I don't say that in a good way, actually. If we look at a retrospective cohort study that was published in 2013, it reviewed the status of over 263,000 veterans from the years 2002 to 2011. And what they found is if a veteran had a BMI of over 40, which now that's classified as morbid obesity, that the cost to the Veterans Affairs was actually over $8,000 more than their normal weight counterparts during the next 10 years of their medical treatment. So if you look at the statistics from 2013, the year that the study was published, there were approximately 165,000 veterans who had been classified or diagnosed with morbid obesity, that 40 BMI or greater. So we did a little math, pulled out the calculator, and we can see that the total amount just over that 10-year period is pretty phenomenal. We got to remember, it's not over a lifetime that this amount is being paid by the VA, but actually it is over a lifetime, not just those 10 years, but it doesn't include the increase in care for those veterans who are maybe not over 40 in terms of their BMI, but maybe between 30 and 40. or just overweight. So you can see that the figures are really going to add up, and that's going to be a cost, obviously, to our entire nation. And I do want to mention really quick here, I'm going to go back to the last two slides. You will see that there are references at the bottom of each of the slides. So if you have any questions, you'd like to read the original articles, there's also write-ups on the Metagenics Institute, which is an educational nonprofit site. You can also go there and read on those articles and get more information. So the VHA, looking at these statistics, realized that there was much more to be done and that could be done. And over the last few years, many new programs have been developed and implemented throughout the VHA system. These are blood sugar education and clinics that have been brought forth. There's nutrition and food services now, dietitians, and then there's also a program called the MOVE program. And the MOVE program was implemented in 2006. It was developed by the National Center for Health Promotion and Disease Prevention. This is an evidence-based self-management program that really focuses in on healthy eating, physical activity, and behavioral changes. It's actually a 19-week program. It can be done with a health coach. It can be done through telehealth. You can use your smartphone with it. There's apps associated with it. There's a website. So it's a very comprehensive program, really focused in on these lifestyle modifications that we know can be so helpful for so many of the chronic diseases and also for weight management. What the studies show, however, is that although this program is successful on an individual level, it might not be as successful or as widely implemented as need be to be successful for the entire veteran population. And we know this because the obesity rate within the veteran population continues to grow among the VHA users, from 25% in 2000 to over this 40% that we're looking at now currently in 2 years ago, 2017. And interestingly enough, what has been brought forth is potentially many of the people who are dealing with obesity may have obviously some of these comorbid conditions that are more veteran specific or military specific that are not being addressed. And that does include some of these mental aspects and mental health components that are not being addressed through the MOVE program. One of the studies that was shown that showed this to be true was a 2013 published study by the researchers from the San Francisco VA that found that veterans who had PTSD and depression and had served in Iraq and Afghanistan time periods, that they were actually not able to lose as much weight or able to keep it off as well relative to those who had also served during those same years but did not have PTSD or depression. So we can see that the MOVE program does have this phenomenal component of changing lifestyle and educating veterans on how to do so. But there is going to be a cohort and a group of veterans who this may not be as successful for, because as we know, as holistic providers, we really need to get down to the crux of the matter. We need to peel the layer, get down to the root cause of what's happening. And in many cases, the obesity, as we know, may be actually literally and figuratively covering up something that's deeper than just behavioral changes and lifestyle modifications. So this is an interesting area, I think, because at this point, a new program has not necessarily been brought forward by the VA to concurrently manage both the weight management and the mental health components. And so I think there's a gap here and a need to be filled. And I throw that out there for anybody who's working in this area, that maybe somebody or some group over the next while will put something together to really bring that forward and to bring the two pieces that need to be connected to be able to connect those for our veterans. So we're going to move next into metabolic syndrome. Once again, the veteran prevalence of metabolic syndrome does reflect the general population trend. And again, if we looked at the active duty trend, we can see that in the active duty service members, there's only about a 23% prevalence of metabolic syndrome. Now, once those active duty service members leave the service, then things do change. a 2017 study out of military medicine followed Air Force personnel who had retired for an 8-year period. And what they found was that when they first retired, their prevalence of metabolic syndrome was right around that 23%. But after the 8 years of being out of service, that prevalence rate went up to about 39%, mirroring the 37%, and that mirrored the prevalence rate within the civilian population. So we can see that really focusing on lifestyle modifications, it doesn't just do good when it only does good when you're doing it, so to speak. You really need to be able to carry that forward over a longer period of time and throughout your lifetime. So I think part of the education piece when we're discussing lifestyle changes and nutritional education and physical activity is that needs to be understood, that it's not a short period of time that you gain the benefits for a lifetime, but in fact that you have to do it for a lifetime in order to gain those benefits. The statistics here for central obesity, or the percentages here, are showing what percentage of these Air Force personnel had elevated levels or dyslipidemia, etc. Another interesting fact is that about 2/3 of our veteran population diagnosed with some form of chronic health condition. And if we look at more than one chronic health condition, 1/3 of veterans have been diagnosed with 3 or more. And when we look at those chronic illnesses, we can actually see that we can pull those apart even more so and look at veterans who were deployed versus non-deployed. And we can see how those numbers stack up against one another. So it does look from this graph here as though the more deployments or people who were deployed do end up having higher risks and prevalence of chronic diseases later in life. Chronic illness is truly one of the areas that we have to focus in on, especially when we look at the financial piece. It's accounting for more than 65% of the VA healthcare costs. And as we know, as holistic and integrative medical providers, that these conditions can be prevented and treated through lifestyle modification. And again, just as we mentioned, though, it's not a short-term lifestyle change, it's a long-term lifestyle change. So we're going to change tracks here, and we're going to move away from cardiovascular and metabolic syndrome aspects, and we're going to look now a little bit more into TBI, PTSD, and chronic pain. TBIs, which are the traumatic brain injury, and we've been hearing a lot more about this lately, especially that the prevalence rate is quite high. And you can see here that in active duty service members who are returning from Iraq and Afghanistan, that percentage ranges anywhere from about 19.5 to 22.8 of having had one or more episodes of a mild TBI, which is also considered a concussion. But if we look at the full range of levels of TBI or intensity, we see that there's mild, moderate, and severe. And those range from about 115,000 to 400,000 cases within the active duty military ranks. And you can see how that splits out between mild and more moderate and severe categories. Ways in which our troops may be exposed and experiencing these TBIs is through a variety of different means. It could be from blast injuries, from IEDs, could be from suicide bombers, landmines, mortar rounds, rocket-propelled grenades. I mean, it really makes it real to us, I think, when we think about how this might happen. We might see this on the news, or we might read about it or hear about it, but when we actually think about the fact that we have a lot of our military service members coming back home and they have sustained these injuries, and this is the way that they actually did sustain them. I think for me anyway, it really opens my eyes to how much is going on and how much we really need to have really great solutions, and we need to come together as a community to support these troops. Now, why am I speaking about service members when this is supposed to be a veteran healthcare webinar? Well, the reason I wanted to mention the prevalence and the risk associated with TBIs for service members is we have to remember that these service members will eventually be our future veteran population. And we know that in general, as people age, their risk for Alzheimer's disease and dementia does go up, same thing in a veteran population. And what we also know is that there is an increased risk of both, I'm going to just call it AD for Alzheimer's disease, moving forward here, increased risk of AD and dementia with TBIs. So I'd love for you to take a look at this original article that is referenced here. There's also, like I said, a link to a write-up that I've done on the Metagenics Institute, and that will take you through more of the details behind this particular study. But what I pulled out on this next slide comes from another article that really gives us some insight into how much this can affect the risk of dementia, of how a TBI can affect risk of dementia. So this is a pretty current article from 2018 from the JAMA Neurology publication, and it shows the association between TBI severity, remembering that there's mild, moderate, and severe, loss of consciousness from that event, and then subsequent dementia diagnosis. And so they looked at nearly 180,000 veterans from the VHA system. And what they saw was approximately 6.1% of those veterans went on to develop dementia. And those were the veterans who had a TBI. And though that was compared to the 2.5% of veterans who went on to develop dementia, and those were veterans without a previous TBI. So what we can see here is having had a TBI, whether it was without loss of consciousness or with loss of consciousness or unknown, increases your risk of dementia 2.36 up to 3.19-fold. And to me, that's just a startling statistic. Then if we look at what happens when those TBIs are not just mild in nature, but they're actually moderate to severe in level, we can see it's a 3.77-fold increase. So pretty dramatic increases with TBIs. And so what does that mean to us? Well, we really need to be screening our veterans, our general population, of course, but our veterans for sure. The VA does a really great job of this. And the reason I mention this in this webinar is I'm hoping we as a community, Hawthorn community and beyond, will be seeing more and more veterans in our private practice. And when we do, this will be something that will need to be first and foremost in your brain in terms of thinking about what their exposures might have been and where some of their root cause issues might be stemming from. When we look at women's health and we focus in on women's health in the military, we find that there's an increase for developing dementia in women as well, and it will depend on their military-related risk factors. And these might be TBI, PTSD, depression, and other specific medical conditions. Approximately 50 to 80% increase for developing dementia if they have one of these risk factors. But also there's actually a twofold risk for developing dementia in these women if they have had multiple military-related risk factors. So once again, we want to be screening women, and it's been an interesting experience myself as a female veteran to see the surprise in people's faces when they find out I'm a veteran. And so I tell you this again, when you are working with your clients and patients in your private practice, to screen everybody, because again, we've seen the statistics as we move forward, there will be more and more and more veterans that are female. So being aware of this will help us to not miss these veterans as a whole. This is a great graphic that is out there on the internet. You can pull it up, utilize it for your needs, but we can see that there's a lot going on behind the scenes for a veteran that people may not be aware of. So many veterans may have had experiences with deaths of very close friends and members of their group that they were serving with. There may be suicides that they've experienced of their friends and peers. We have deployments happening, and so there's this military family component. We say that there's TBIs and PTSD, and all of this is happening in a milieu, and it's all impacting one another. So not to forget that rarely will it just be one thing. We have to remember that many things are going to be happening for our veterans when we're looking at their health care. So we're going to transition again and go into PTSD, and that's post-traumatic stress disorder. We can see here, depending on the era that the veteran served, that there's anywhere between about an 11 and 30% of our veterans that have either experienced or currently experienced PTSD. If we're looking at Vietnam vets, we're all the way up to that 30%. Interestingly enough, though, the data suggests that within a general population, we have to talk about the general population here because we don't have this particular data information for veteran-specific populations at this point. But within the general population, for those who have been diagnosed with PTSD, 30% are treatment resistant. Non-response rate for cognitive behavioral therapy can be as high as 50%. And then the non-responsive rate for SSRIs might be in the range of 20 to 40%. We also don't know what proportion of service members and veterans who have had PTSD may actually recover without intervention. So there's quite a few gaps here, areas again that we need to learn more about, and also areas that we need to find solutions for. Once again, the VA has created a phenomenal program. This one is called the National Center for PTSD. And I'm going to take you through a couple of screens here, but I would really recommend that you actually go to this website when we're done with the webinar here today and just take a peek around, experiment with a couple of the different areas that you could go into. I always think it's useful to have those resources at your fingertips if you may find that you need them when you're speaking to somebody at a restaurant one day, or you're in your office, or you're on a train or a bus, wherever, you know that these exist. And so this particular program has several different components. One of them, the first one on the left, talks about what PTSD is, what treatments are available, and also really talks about the impact and symptoms that are associated with it. The about face components are personal stories. It also talks about the family component, because remembering this is not just an individual. In most cases, it's not just the individual who is dealing and suffering with the condition, but also their family and their extended family. And then there's an app called the PTSD Coach. And on this next page here, we can take a quick peek. Again, I'd really highly recommend that you look at it, maybe even download it onto your smartphone so that you have it and you can recommend it or even utilize it. It's not something that can only be utilized by veterans. It's free. You can download it at any point for anyone. So this here is the app that allows you to decide, do you need to call somebody? Do you need to work through some symptoms? Do you need to track your symptoms? Or do you actually need an intervention right then and there? And if it's an intervention right then and there that you want to start working with, you can click on a couple of different links, and it will take you to this next screen here that allows you to decide what area you want to work on in the moment. Do you want to be in the moment? Do you want to work on changing your feelings by changing your thoughts? Do you want to learn to be more assertive? Do you want to relax your body? So there's all these different things you can do, right? Or things that you would like to try. And you get to choose and you click one. And so what I did for this next screenshot here is I clicked be in the moment. And if you click be in the moment, it gives you a whole bunch of different things that you can do. And one of them being, I want to simply ground myself. I feel very discombobulated, disoriented, disconnected. I'm anxious. I'm not feeling great today. I need to ground myself. I need to center myself. And there's probably about 15 different little links that you can link into right here. I just screenshotted the attached to the earth one here, but there's many others. So for example, there's one that says, be in the moment by sitting quietly, closing your eyes and smelling the smells around you. Or sitting quietly and feeling your feet, and then your knees, and then your hips. So you can see there's various things depending on who the individual is that needs this app at that particular time. They can choose the activities that best suit them and that they resonate with them, with what they need at that time. So this is a great app. Again, recommend that you take a peek at it, play around with it, and see if it might be useful for your practice. There's the link right there, and you will have access to these slides. I believe Paula said in just a couple days. I put this in here because, like we just talked about a few minutes ago, it's not enough to say somebody has chronic pain and treat just the pain. It's not enough to say that somebody has PTSD and just treat the PTSD. As you can see here in this slide, if we took N of 277 for chronic pain, and we found that 81%, 81.5% were positive for chronic pain. You can see from that yellow circle that actually only 10% have only chronic pain. And in fact, there's 16.5% who have chronic pain and PTSD. There's 12.6% who have chronic pain and TBI. You can do the same if you look at the TBI N of 227, or if you look at the PTSD N of 232. And then if you go, of course, to the middle section, you can see there's a full 42% of the group here that actually is experiencing all three. So this slide is really just to illustrate the fact that it's rarely one thing. We've got to dig deep as providers. We've got to get down to the root causes, most likely, and that's where we really need to focus in on. If we look at chronic pain, we can see that veterans do report more severe pain compared to their non-veteran counterparts, 9.1% compared to the 6.4%. And that, in fact, 77% of veterans report that pain control is one of their top 3 priorities when they're seeking out primary care. Goals, of course, for chronic pain is to reduce their loss of productivity, improve their quality of life, and reduce the burden of long-term healthcare costs associated with the pain and, as we just noted, the comorbid conditions that come along with it. This is I was so excited to find information on this over the last few months as I've been learning more and more about the initiatives that have been taking place within the VA. The DoD has noted that one of its major priorities is to look for and find science-based, non-pharmacological alternatives for opioids to treat chronic pain. That gives us a tremendous area as holistic and integrative providers to offer additional therapeutics that are safe and that are beneficial. So for example, if we look at this transforming VA pain care under the 6 essentials elements of good pain care, and we dive down into number 3, and we pull that out, we can see that developing and integrating non-pharmacological modalities into care plans is part of their plan. So for example, if we were to look at low back pain, we would find in the VA guidelines now that they are recommending yoga, they're recommending acupuncture, massage, spinal manipulation, and progressive relaxation. This, I just pulled 5, there's others. And there's nutrition associated with this now, there's certain botanical medicines that are also being looked at. So there's a lot of, like I said, there's a lot of movement and there's a lot of more holistic and integrative approaches being utilized within the VA. This slide here is showing a stepped process of managing pain according to the VA, and this is something that they're now utilizing. And if you look at step 1, very exciting, under self-care, the very first thing they're recommending is looking at nutrition and weight management. That's followed by exercise and conditioning, sleep, mindfulness, meditation, relaxation techniques, engagement in meaningful activities, family and social support, safe environments and surroundings. So you can see that a lot of what we're doing and what we have a background in, as well as the evidence in, is being utilized within the self-care for chronic pain management. And as you move up the steps here in terms of step 1, 2, and 3, you can see that it continues to add parts of this integrative process as you go up. In order to bring all of this together, in 2010, the VHA established the Office of Patient-Centered Care and Cultural Transformation, or OPCC and CT. And they worked together to create a program, or a model, if you will, that would bring together the ability to focus on treating specific issues, but still being personalized, proactive, and patient-driven. And to me, that is music to my ears, and I'm sure to a lot of you as well. And since that inception of this particular office, they have completely transformed the healthcare within the VHA through the creation, education, dissemination, and implementation of the whole health program, which you're seeing here one slide of. The health approach empowers and equips people to take charge of their health and well-being and to live their lives to the fullest. And in order to do so, it actually has 3 core elements. It has the pathway, which helps people to look back on what is actually causing some of the issues, if there's some mental health, emotional health components involved, and to dig deep there. There's self-care, and that brings into the program the nutrition, the food shopping, the cooking classes. It looks at stress reduction, yoga, tai chi, qigong, acupuncture, massage, and many other aspects. It has a core element of coaching, health coaching, and as you can see, of course, nutritional professionals and dietitians. And then we have the clinical care, which is a collaboration between primary care, specialty clinics, and also CIH, which is complementary and integrative health modalities. So again, so many words that we have spoken for so many years are now being pulled into the center of a new paradigm within VA called the whole health system. So it's, like I said, a very exciting time. It's very timely for what we do and what we know works, and for us to be able to, as holistic practitioners, to bring forth what we have utilized for decades and much longer, to support what the VA would like to do. So we've read through a lot of this here on the left-hand side. The DoD and VHA have made whole health a major focus through the year 2021. So we still have a couple years where this is being built out and implemented and rolled out across the country. In 2008, they actually stood up 18 whole health sites across the country, and you can see on the right-hand side here, different locations. If you're in any of these areas, I would highly recommend that you maybe take a little trip over there and maybe even introduce yourself and see what's happening in your area. So we've talked about a lot of different chronic illness aspects. We've talked about some of the mental and emotional impact that being a veteran and the experiences a veteran has had impact their health. But what we haven't talked about is so many other aspects of a veteran's background and experience. There's just not time, of course, to go into all of it, but there are aspects of toxin exposure. There's Gulf War illness. There's the women's health aspect in terms of fertility, where a female veteran's infertility is 2 to 3 times greater than the general population at the same age. So there's definitely things going on there as well. There's the military sexual trauma component, amputation, loss of limbs. There's transition challenges, and transition being when you leave the military and you go into the civilian sector and you have to learn a whole new lifestyle. It's being dropped into almost I want to almost think of it as like an alien environment. You don't know how to walk anymore. You've learned how to walk completely different. You've learned how to dress completely different. You've learned how to speak completely different. And so to transition into a civilian environment without a network and a community can sometimes be difficult for many of our veterans. Understanding that and having that may be happening with some of the veterans you're seeing and working with will just help you to help them more. And of course, we never want to forget our military families and caregivers, because they also have a very heavy load sometimes that they carry. Looking at long-term outlooks and needs, the Institute of Medicine of the National Academies has a huge tome. It's hundreds of pages, and one of the quotes that we pulled out of there, it says, "Previous wars have demonstrated that veterans' needs peak several decades after their war service, highlighting the necessity of managing current problems and planning for future needs." And that's really important when we think about 9/11 in 2001, and here we are 2019. We're peaking now in terms of when our veterans are going to need our care. And so coming together again as various communities and learning from each other and putting programs into place, we can stop the insanity. We can really change things for the better. If we don't, I'm not going to be Debbie Downer, but if we don't, here is what we might have to look forward to. We already know that these are some of the components that we should be very concerned about within the veteran population. We've got depression, problematic alcohol use, substance abuse. We have an employment rate that's almost double in terms of veterans versus their similarly aged non-veterans. We have a homeless component. 11% of adult homeless population are veterans. And then, of course, we have the suicide that's been a very, very big topic over the last few years. On average, the Department of VA showed that 20 veterans die by suicide every day. That's a 22% higher rate when you compare that to the non-veteran US adult population. It's 19% higher for looking just at males and 2.5 times higher if you're looking at females. We also find that there's an age difference. Approximately 65% of all veterans who died by suicide in 2014 were over the age of 50. So this is a big area. We need to delve in, we need to dig deep, and we need to find answers and solutions to this very big problem. The VA this year is spending $47.5 million on this problem, and hopefully we can all be part of the solution. As part of that solution, once again, I would highly recommend grabbing your phone right now, and if you can, put this number into your phone. You'll have it whenever you need it. You never know when you'll need it. There's a Veterans Crisis Hotline. All they have to do is call it. You can send a text message. You can't link from here, but you can add that link into your phone or wherever you are. So there's always help. It's just a matter of having the resources at hand when you need them. So what gaps still exist? Well, I want to really pull this apart here and show you that although we have 20 million to 22 million veterans in the United States, only a third of those are using these phenomenal VA resources that we've just talked about. It's because only a third are seeking their healthcare or getting their healthcare through the VA. The other 2/3 of those veterans are in your local community, and they're seeing local community providers if they're being seen by a provider. So it's really important for us to remember, because we may very well be seeing veterans in our clinics right now and in our practices without possibly even knowing it. The VA Whole Health, as we noted, will be partnering with the complementary and integrative healthcare providers that are outside of the system, if you will. They'll be doing this through several different mandates and acts that have come through the VA, one of them being called the Choice Act of 2014, and the other one being the Mission Act of 2018. And these are actually for veterans who are being seen at the VA, but who cannot get all of their services at the VA for a variety of different reasons. It could be that there's too long of a wait time. It could be that they live too far, or that the services that they need, whether it be yoga, tai chi, acupuncture, massage, some sort of complementary and integrative healthcare service, is not being offered at their local VA. In that case, the Choice Act and the Mission Act have given openings and opportunities for community healthcare providers to provide those services to the veterans. So if you're interested in that, we can definitely, I'm happy to speak to you on it a little bit more, but definitely go to these different websites, call the VA, talk to the Choice Program directors and the Mission Act directors, and find out how you can contract with them to provide services to the veterans in your local area who are being seen at the VA but need additional resources. So that's the Veterans Choice Act and Mission Act, and that's more for the contracting of services to the VA and to the veterans. But there's also community partnerships that are available, and those are for not for contracts, but actually partnering with the VA to create programs together and to help to support veterans to get care from the VA and or through your local complementary and integrative healthcare center. So it's just a way to bridge the two communities and bring them together to support the veteran population that is in your local community. So if you're interested in working with veterans, first of all, thank you. And second of all, where and how might you start? I'd say personally, the first thing, if you are not a veteran or you don't have a background in military or veteran healthcare or just the cultural competency component of being in the military, is that you start there. What we've seen in a recent RAND report that looked at nearly 800 primary care clinics in New York State, all of them who were treating veterans, they found that while 92% of them were actually seeing and accepting new veteran patients, that only 2.3% actually met the criteria for actually effectively serving the veteran population. So we're seeing that these veterans aren't getting that unique healthcare experience and modalities and therapeutics that they might need for their unique backgrounds. We know that in general, sometimes when we think of veterans, we think of tough, we think resilience, and really that you will find that that is true. we do not want to be seen as weak. We went into the service for the most part to be of service to our communities, to our families, and to our nation. And it's not something that we take lightly when we ask for help. So when a veteran has felt like they're not understood, or they are not seen as being a unique patient, if you will, or client, sometimes that can negate the ability for that provider to actually give help and support to the veteran. So I would say the first place you really need to start is understanding a little bit more about the background of a veteran, background of the military component. And we're actually working with, when I say we, in general, the functional medicine group and our integrative platforms and initiatives right now are working with providing some of those cultural competency pieces so that we can roll those out to community healthcare providers. So hopefully that'll be coming down the pipeline really shortly here. A couple of quotes I just wanted to throw out there because I love them. They're near and dear to my heart. I use them every day on my kids. Adapt, improvise, and overcome. And that's really what you're going to see in most of our military service members and veterans is you might not have all the materials to get the job done, but the mission must go on. So Semper Gumby, always flexible, figure it out, finish it up. How can you be part of the solution? So we just talked, know your patient, get to know the background of the military, get to know the background of your veterans. And then if you're in the civilian healthcare provider network and you want to be part of that VA group, learn more about the Choice and Mission Acts, learn more about the veteran community partnerships. Again, those were on slides previously, and there should be a link where you can get more information. You can also see veterans within your private practice, and what I would really recommend is that you create some sort of veteran-centric programs or ability for the veteran to know that you have a veteran component to your clinic or your practice. Because of our unique backgrounds in holistic nutrition, integrative medicine, functional medicine, naturopathic medicine, what we know is that we could become valuable members of the VHA team, particularly now that the whole health at the VA is being rolled out. So if you're interested in working with veterans and from that perspective, I would recommend that you check out these two websites and see what kind of jobs or employment opportunities may be available that way. If you're looking at nonprofit veteran groups, there are so many wonderful groups out there, and I would highly recommend, again, that you just get involved maybe in a local nonprofit group, first of all, and start to find out where your niche is and where you feel called or really pulled to work with the veteran community. It may be in the area of homelessness, it might be in suicide or PTSD, maybe it's in women's health. You'll find the area if you're so inclined, and again, there's tremendous groups out there. And then just be open to the possibilities. If something doesn't exist and there's a need, well, that's where the adapt, improvise, and overcome comes in. We've got to create it. We've got to figure out what solution is needed and just go for it. And I really believe if we all do this, we will not only be helping the veteran population, but we will be helping our nation's healthcare at large. Other updates, just to give you a little bit of food for thought on what's happening out there right now. As I said, I'm working with a company right now to support the production of a lifestyle modification program that would be veteran facing. So it would have that cultural competency criteria. And what we're looking at is how do we roll that mental health aspect in? As we looked at the obesity and the metabolic syndrome slides earlier, we saw, or we talked about how mental health has to be an aspect of approach for the obesity component for many of our veteran patients. If you're interested in functional medicine, take a look at the IFM, which is the Institute for Functional Medicine website. We're having our annual international conference in San Antonio in May 30th through June 1st, so coming up in just a bit here. And it is just truly phenomenal. We have a large number of military and veteran healthcare speakers on various topics related to stress, pain, and addiction. So this is going to be a really great opportunity to bring together the local and civilian healthcare providers with the military and veteran healthcare providers to speak on these topics of the stress, pain, and addiction within not just veterans, but also general population, and how we can share some of our resources and knowledge. I'd also highly encourage you to take a look at some of the posters that have been submitted for this particular conference. You can see below that they're really, that the whole health is looking at functional medicine. And in this particular case, looking at the coaching aspect to help chronic pain in the Iraq and Afghanistan war veterans. So again, there's just so many opportunities, a lot of research being done, and we're right on the cusp of it with what we do. I also wanted to give a shout out to one of our alumna right here from Hawthorn, Crystal Shapiro. She wrote a book called The War Within, and it's available on Amazon. She comes from I believe, I hope I don't get this wrong, I believe it's an Air Force family, and she's written a beautiful book on a holistic approach to preventing veteran suicide. So this is just the tip of the iceberg. There is so much being done, so much that still needs to be done. And I hope that we all have the opportunity to be able to at least take a little bit of today's webinar away. And if we run into a veteran, we just have a little bit more of an understanding and background of where they might be coming from. So thank you again for your attention today. Paula, I really appreciate the ability to have been able to do this and present this information.
Certainly, I'm so pleased, Dr. Garilli, that you were available and so passionate and involved in this project, and for bringing possibilities and potential solutions and encouragement to all of us to get involved. You know, I want to say just right off that this presentation is not about or not military. It's not about the military industrial complex. It's about a huge population that's in need and finding solutions and implementing. So let's get to it.
I agree.
Right? You know, I want to just step back a little bit. We talked before we got on the call, Dr. Garilli, but how did and why did the Vets Initiative get started?
Well, I think, as you and I had discussed, Paula, there's quite a few different groups becoming involved. And the big piece, in my opinion, is that the DoD and VA have realized that we have to find solutions, particularly for the chronic pain and the opioid epidemic, through a non-pharmacological approach. And, you know, interestingly enough, the more they dug, the more they realized that maybe the complementary and integrative healthcare sector had some of those answers, which, you know, is a really great segue to collaboration. And that's what I think is really, there's so many beautiful pieces here. And one of the great pieces here is how much collaboration is happening. We're seeing generals and colonels and captains in the healthcare sector talking to civilian providers and to patients on, you know, and veterans, and really bringing that together. I was just at the Veteran Healthcare Conference in Washington, D.C. this past week, and we had some wonderful speakers. And again, it was coming down to, how do we find solutions? We have to partner with our community. We have to partner with the civilian side. And so the gates are open. And if we have solutions within the civilian sector, we have to be bringing those, and we have to have them evaluated so that we can work together.
Well said, thank you. When you raise the issues of obesity and all the conditions, really, metabolic syndrome, the health conditions primarily, but you didn't really say, what is the diet and lifestyle of, what are the components of what our military personnel and veterans are eating?
Absolutely. So it's probably going to vary between not only branches of service. It will have changed since I was in, which was 20 years ago. And it will also depend on where they're deployed, where military service members are deployed and where they're living at the time. So there's a lot of factors involved. It will depend on whether they are living in the barracks, or whether they're living in, you know, they're married and they live out on base or base housing. So again, a large number of factors. And really what it comes down to is, when I was in anyway, the nutrition was not a factor that was highly discussed or thought about, or there weren't a lot of options. It was either you ate what was at the chow hall, or you cooked your own, or you went out and you got it. Or if you were in the field, you ate an MRE, a meal ready to eat. However, what was highly encouraged and done nearly every day was physical activity. So when we're looking at the fact that many active duty service members are more fit than the general population, it would be my guess and my hypothesis that it would be more because of the physical activity than it would be the nutrition. So when our military service members become veterans and they transition out, typically that physical activity begins to dwindle. And so now you're still left with whatever nutrition either they always ate growing up, or what habits they developed in the military. Now, again, I think that's changing. I think there's more awareness. I think the education is starting to come out. We were at Fort Belvoir I was there 2 years ago, and it was an Army hospital that we were in. And there were signs all over talking about nutrition. So I was there with my peers from Metagenics, and we were so excited to see these posters that was talking about healthy eating and healthy lifestyles. So again, I truly believe there's been a change since when I was in, but I think for when we're looking at why that transition happens, I think a lot of that has to do with the physical activity component.
Okay, thank you. You also spoke to the PTSD specifically, saying that 30% of the population was treatment resistant. We're wondering why they're treatment resistant, and also in general, I think you were talking about vets not meeting the criteria for certain platforms or certain programs, and I'm not clear what the criteria is.
The second question you had there, I'm not quite sure what that's what your question is referring to. We could go back and take a look at that slide. But the first one, treatment resistance, would be that they went through the levels of treatment, whatever those might be for each of the therapeutics that are being offered, and that they still had the PTSD when they were done.
Okay, thank you. I'll find the slide and come back to that later. Reframe it, okay? Okay, so we do have several veterans on the call with us today. I'm pleased and thank you for attending and for all your participation here. And there is some comments from a female vet, and when you first started framing the whole situation and the numbers, male to female, she says that women are low in this because they're afraid to be recognized since they were treated so badly. She feels that women are actually higher, but just not accounted for.
In terms of the percentage that make up the veteran population?
Yes, yeah.
It could very well be. I mean, we're only going to get the data that is offered to us and given to us, right? So if females do not fill in the surveys, or if they don't give an answer that, or they don't participate at all, then absolutely those numbers could be skewed.
And also the point that perhaps you're not looking at Cold War vets or peacetime veterans either. So
the pre and post 9/11 does go prior to that, so peacetime. And so this is data, just so that everyone's aware that, you know, it wasn't something that, or this data does come from either the Veterans Administration or the DoD in general. So, you know, the data is only as good as whomever has collected it. So we, you know, there's probably various numbers out there that we could utilize. But those are the big ones. Those are the major categories that come up when you do the research into these particular conditions.
She's indicating that there are a number, you know, particularly females, but certainly men also, that refuse to deal with the VA. Saying that the VA cannot and does not want to deal with vets who do not respond to allopathic medicine. she herself has been trying to get care for up to 3 years and has been told that they don't know how to treat her.
Well, I'd be happy to take the, I don't work with the VA, but I'd be happy to connect with her offline. I don't unfortunately have an answer for that, not being a VA employee. But there are, like I showed you in that slide, there are a full 2/3 of our veterans who are not seeing practitioners in the VA for a variety of reasons. Some may not be eligible, some may not want to, some may feel that they are being treated, that are being treated unfairly or accurately. And for those 2/3 is one of the reasons I am so adamant about creating our civilian sector to be able to treat vets and understanding the cultural competency, because I do believe that we have a role here to play, and that we can't play it if we're aware. I don't know how many of our civilian providers are aware that they may have, dozens maybe of veterans in their practice, and yet they've never asked them if they were a veteran. They don't know how to speak to them in terms of background. They might not be asking the right questions to understand what their experiences were. And so if we can open up that conversation, then we have other resources for veterans who do not, cannot, won't, whatever the case is, go to the VA.
Yeah.
And I think we absolutely need that for everyone.
Hence this presentation. So thank you.
Absolutely.
And is it accurate that in order to be seen at the VA for PTSD that you have to have been you have to have seen conflict?
Once again, I can't answer that per se because I don't work at the VA. There are criteria to being able to be seen at the VA, yes. So for example, I personally cannot, at this point, my claims have been denied to be able to be seen at the VA for a variety of reasons. One is I don't have a certain level of disability. There's a financial factor. So there are some veterans who will not be eligible to be seen at the VA, not necessarily because they have PTSD or don't have PTSD from a certain conflict, but more along the line that they were just not eligible in general.
Okay.
But there's an appeals process.
Okay.
So that's also something to keep in consideration.
And it also sounds like, things within the VA are changing dramatically with recognizing the need. And so while she herself has attempted to get acupuncture or massage, it's been very strict and they don't offer it and they're not available. And also, again, coming back to civilian or private providers, they're not, she's saying that they're not taking VA patients because they're not getting paid by the VA.
I would hope that, with this Choice Act and then the new Mission Act, that's hopefully what will get ironed out.
Yes.
So it's more of a seamless process.
So you're saying that now the VA may be willing to pay for functional medical practitioners or integrative practitioners?
So through the Choice Act and the Mission Act that was just added this past year, you can, as a civilian provider, and I don't know what the criteria is, and that's why I highly recommend anybody who wishes to participate definitely gets more information and goes through that process, is that you can you can contract with the VA to provide service to particular veterans who meet a certain criteria through the VA. So they would have to be eligible through the VA to come and see you at your practice. And if that was the case, there is reimbursement.
Okay, thank you.
So I agree, Paul. I think, and that's what I think is probably one of the most frustrating things is, if you've already had a bad rap, let's say the VA over the past several decades, right?
Yes,
if you've had a bad rap, it's going to take a lot to turn the ship around. And I'm hoping that will happen and that our veterans will be more supported. We're seeing that there's a need, but as I said, having gone through our veteran healthcare conferences the last couple of years in DC, and then also seeing what's happening through IFM and through other functional medicine groups, is that the VA providers and those who are in positions to make change want it. And I can only imagine it's going to take a long time because it's a behemoth of an operation and organization.
Yes.
But that it is, I have hope. Let's put it that way. I have point that
I have hope also, you know, when you have an organization like IFM getting involved as deeply as they are, and the number of practitioners and medical providers involved with IFM leading the charge, so to speak, it's very hopeful. And while, you know, things may not have been great for everyone within the VA, I certainly know a number of vets personally who have had tremendous experience with the VA and have been helped. So, you know, it goes both ways, and I think their eyes are open to the needs, and, you know, hopefully this initiative will really make a difference. It's absolutely needed, and
we can try, right, Paula? That's what we have to.
This is a big effort. I mean, you know, for you personally, as a health provider and a naturopathic doctor, how are you opening up your practice to vets?
Absolutely. I would really like to bring together this lifestyle I've always worked in lifestyle medicine. That's always been the basis of my practice. And I'd really like to bring more of a community, veteran community associated lifestyle medicine practice that brings together groups of veterans to support one another. I also believe that there's power in groups and peers and being able to work together as a team. There's just a lot of, I think there's a lot of forward movement that can come from that, and camaraderie and understanding of one another.
Yeah.
So with that piece, though, as we've seen, you know, there may need to be multiple prongs to it that not only bring in the modification component, but a mental health piece as well. Most likely coaching. You know, there's a lot of pieces to it, and I think that's going to be where I head with this. And it'll have to morph, it'll have to change, it'll have to evolve over time as we see how it works.
Yes. Yeah. You know, Dennis is on the call today, and he is also saying that it's also good for vets to document any health issues with the VA, even though one might not be eligible now, they might be in the future. Things are changing.
Absolutely.
The organization that we have with the VA, and while there may be some dissatisfaction with it, I think it's important for me to have a positive attitude and look at the ways that I can contribute to this population personally and as a practitioner and an educator, and how I can be influential with my colleagues in the field as well, and to speak broadly and openly with vets that I meet and in my practice, to let them know about the changes that are happening, the initiatives that are being proposed, and the opportunities for improved health and healing outcomes to take place.
You said it perfectly, Paula. Thank you.
You're welcome. I want to thank you so much, Dr. Garilli, for all the resources that you brought to this. The links are tremendous. All the published work that you directed us to investigate further. This is a slideshow to go back to and really explore the slides in detail. For those of you that have been inspired by this presentation, I encourage you to take a look again, because there's a plethora of options in there, and I think that one of the main points that Dr. Garilli is speaking to us is saying, know the population, know who you may be speaking to, and want to be able to support so that you can be an informed practitioner and work within your community to really make health a priority in this population. So thank you again, Dr. Garilli. I applaud you for bringing this on and being part of the change that needs to happen.
Well, thank you for having me.
Absolutely. I have a few closing comments, just a few. Like Dr. Garilli said, this webinar was recorded. It'll be available in just a few days on our website under archived webinars. Please, if there's anyone else that you think would have value for this, spread the word. It's an important topic, it's an important presentation, and it should be viewed broadly, in my opinion. And as usual, there's a survey to fill out after the webinar, and it always helps me to have your feedback and any comments about this presentation, so I appreciate you taking the time. And heads up about our next webinar is on June 18th, and we'll host Lisa Fraley. She's a holistic lawyer, and she's going to share with us about our online client practices. And then heads up about our next All About Alumni is Wednesday, June 5th at noon, when we have our Master of Science in Holistic Nutrition graduate, Libby Barkochba. She's going to be presenting on her post-grad activities. And you know, we've just had so many terrific interview presentations with the grads. Check those out in our archives too to be inspired for that. I think that's just about it. I want to thank everybody for taking the time and showing up here today. And I want to express my gratitude for the work that I do and the participation of James Bernardinelli, who is our engineer and co-produces these webinars with me. Thank you, James. And I think that's it. Just thank you again, Dr. Bianca. It is fabulous to have you with us anytime, and this particularly.
Thank you, Paula. It was my pleasure.
Right. And thanks everybody for sharing this time together. I wish you all the best of health. And I certainly look forward to learning more together at our webinar series as well as our All About Alumni. Until then, take care.